my song, yes, my shield, my rod and my song. When the and friends forsake me, He is. Oh, yes, He is.
Someone. So it's our goal in talking with everyone here as we seem to have pulled together a group of organizations that are committed to some aspect of the mission around improving mental health care. And that may be very different things to very different organizations. And it may come together nicely, it may be a little bumpy, but the goal is to, at some point, we look, 5 years down the road, like, wow, look what has been done. Now, people are being taken care of near their homes. Stigma has been addressed so that people who are suffering can actually come out of their homes and receive mental health care. There's a spectrum, as Greg mentioned, although I should say Kwame is your
that's right. I forgot my name already.
Yeah, I forgot his name already. There's a whole spectrum of what we call mental health and notion that we have to be able to take care of the most severely ill. But then there's a whole spectrum of people who are surviving, working, but they're still suffering, and they're suffering silently. We have to come up with solutions to improve their productivity, improve their ability to take care of their families and their children, because if you don't, then you affect another generation, right? So if you have a depressed parent not taking care of their children well, then their children have problems as they're trying to go through school and so on. And so there's a lot to do, simply put. But I think that we have had the experience in a number of countries targeting very specific areas. But at the end of the day, the goal is to transfer skills, get organizations to work together, and more importantly, and I think this is what I think WingSpan, and why the approach is actually quite unique, is that WingSpan has been working to develop a development approach so that we are not here sitting in this room competing against each other. And that's the biggest problem, particularly around mental health, because mental health is so poorly funded that we are all competing for that 1% of the global health pie. Right? Am I right? Yeah. You sit, you're like, I don't want to talk to this guy because we're competing for the same grant. Well, for this to work, we have to say we're not competing, we're working together. And the development plan will allow us to do that. And so that we are much stronger together than each individual trying to put together this small grant application and so on. And so WingSpan's role is to really help us collectively develop that approach as we build it, when you guys are going to guide what needs to be built, right? What are the priorities? What are the approaches? And we will bring what we can to that. And in particular, we'll bring some science in that, let's study it, let's figure out what works best. And so then it can be scaled up and that sort of thing. But the notion is that we're going to bring it all together and not be competing with each other for that small 1%, but we're going to be working to get 10%. And everybody's organization is supported, new resources are brought in, and everybody starts working together. And then you start building this community. It really becomes a community approach, and it's from bottom up and top down, kind of working together. Now, as Kwame pointed out, we have we have a faculty of 700 psychiatrists and psychologists, probably 100 social workers, probably 200 psychiatric nurses, and we've worked with community workers, and I work in a community health center. So we're used to working from, at all levels, and it works when it works together, when people are working together. And Greg, the new term is not task shifting, it's task sharing. So that these names change every year. Somebody comes up with something new, but it's task sharing. But it's everybody working together to improve the care of people suffering from psychiatric problems, and building from that. So if you think about it, no matter what your organization does, mental health touches everything, right? You're talking about education. You have to address, mental health in schools in order for kids to learn and to go on and to be successful. If there's no intervention in schools to get those kids who are falling off the track and so on, then you've lost them. And that's a whole population of people that we can actually help that may be lost. So it touches absolutely everything. So again, I'm going to stop talking because I can ramble, but again, we are delighted to be here, but we are here as partners, and we're here to learn, to hear from you, and to figure out how we all work together. And I mentioned while you were out that WingSpan is working to develop the development portfolio so that we're not competing, we're working together. And so we are much stronger working together than competing against each other, which is typical in just about every country that I've been in. The NGOs are fighting. They're working, and like I come back 2 years later, and nothing has gotten done. It's because they're still fighting for that same little piece, and everybody has a model, right? And so we don't have a model. We have ideas, and they may be wrong. So we come here to learn. We learn from you, and then we then together we build something. And most times you give it your best shot, right? But we're not going to come here and try to plop a model down and say, this is the approach, and this is what you have to do. We're here to learn, and so we hope that everyone here is comfortable talking and giving their opinions and so on, and talking about their experiences, because it's absolutely critical during this period where we're this is the learning period. So it's absolutely critical. So I'll just stop here and turn it back over to Adjoa.
That's great. Thank you, Greg.
Medical science at the Nelson Mandela University in Durban is to develop a generation of African experts and scientists. So the talent, which is definitely here in your young people, doesn't have to go abroad, doesn't have to go to the States or to the UK to experience their dreams and the fulfillment of their dreams. They can actually be trained in their homeland. And what Dave was describing, the dream here would be to have a center of excellence where young Africans from Ghana and perhaps even West Africa could come and really have the opportunity to fulfill their dreams, to become experts themselves in the medical sciences and the biomedical sciences, in psychology and social work and so on. And we can then have the capacity building we need in Ghana and West Africa. So I think that's a big dream. As Adjoa just said, this is the first step, 1,000 miles, but might as well think big. We know a visionary, the public health, the #1 public health doctor in the United States who was successful in helping eradicate smallpox said, when I spoke to him about mental health and global mental health, he said, well, public health is a field where you need unwarranted optimism. And that's what we need here in this room today as we start on this journey, unwarranted optimism. Otherwise, we're not going to get started, so we might as well, and he also said, you might as well join the optimists. It's going to be hard no matter what, so you might as well sign up with the optimists. So that's what we're here to do.
The lady who got pregnant in the third year in high school, and then she had to leave the high school to go deliver, and then come back to write the exams, and she makes her ACE distinction and comes to the university to pursue medicine. Now, she was apparently impregnated by her stepdad. Okay, so then she would not be able to tell her mom who impregnated her, tell the school authorities who impregnated her, but she can confide in her grandma. And so she's in school, and she brings forth a girl. And that baby girl is in the care of her grandma, and always has this premonition that what she went through, someone might be taking a girl child through the same thing. And so as I was invigilating, she had been repeated twice. And by the time I left the university, she had repeated for the third time. So as of now, I cannot tell. It's been 7 years down the line, 2006. I can't tell whether she's been able to complete the university and become a medical doctor, as her dreams are, or such psychosocial conditions might have enabled, taking her off academia. This is just a story I want to link into it. But also, I'm working with the Ghana Health Service as a biomedical scientist. I have seen policies transcend along the line. For instance, you're all aware that the mental health bill has been passed, which would mainstream mental health care as part of the general, not to relegate some kind of people who say, oh, these people are mad, let them be here. But a lot of people have other issues which could be classified as such. And so we knew of the unit called psychiatric units in the hospitals. By 2010, it was renamed mental and neurological units to give in to other larger scope of things that could be mentally attended to. Working in a regional hospital in one of the regions, I never encountered one psychiatrist or one psychologist in the hospital, but we had physicians, general practice, we had gynecologists, we had orthopedic surgeons. So it tells you that the issue about mental health, we got staffs, we got some of the staff, health professionals, who themselves had mental problems. Sometimes they were chained, injected to suppress their aggression. So the thing is that, okay, everybody wants to avoid it. This guy is aggressive from the mental health. But someone's aggression, as Mrs. Acquaah-Harrison said, might be covered underneath their clothes. So this platform for me is an opportunity to firsthand learn from the various strategies that will be devised in meeting mental health care in the country. But more importantly is to look at various approaches that would be a shift, okay, from the governmental approach to incorporation of other bodies like NGOs and other sororities helping the government of Ghana in general. Well, I'm not talking for the government of Ghana, but I work for the government of Ghana and the people of Ghana and into public service, so that other bodies can partner in that tax sharing, as he talked about, can partner the government in meeting the health mental needs of a country which must be mentally sound to bring about productivity and to bring about a general buoyancy in the economy. Thank you.
Some of the primary difficulties, but it's a whole package. It's not, the medications don't cure anything, right? They help, they reduce symptoms, but it's within the family context and the community context, and getting them to resume their lives on the go while they're getting better, while their symptoms are reducing and so on. It's critical, not waiting in the hospital until every symptom is gone. And then they come back and they're like, well, what do I do? I'm not used to doing this because now I'm on the need for these psychiatric hospitals, rehabilitation programs that take people away. And it's simply an unnatural environment. I remember we were in Uganda, and one of the things I was most impressed with, that they had a unit within the general hospital that was short. You know, the maximum that someone could stay there was 7 days. That was the absolute maximum. But what was nice about it, the family was there with the person. So the family was bringing food, and they were there. Like, we went to a bedside, and the patient was saying, like, yeah, come to my bed. And I thought, okay, this is great, you know. But and then we were walking up to the bed. There were 7 people on the bed. And I'm thinking, oh my God, this is horrible. They have 7 people to a bed. 7 patients to a bed. This is horrible. But it was their family. Their family was right there with them. And they were listening as the doctors and nurses were talking. They were going, yeah, they were listening. So they knew what the treatment was. And they were involved in the treatment. And then suddenly the person's back in their home. And the family or you know, empowered to, like, you know, make sure you do this, you're supposed to be doing, you're supposed to be going for a walk, you're supposed to be studying, and all of that stuff. So it's that, you know, taking people, removing them out, we have to move past that to keep people in the context of their lives, and then help them get better.
Yeah.
Let's watch what we do. Remember, part of this mental health situation is not just those who have cast their clothes off and they're walking naked. As for them, they've taken the position and saying, here I am. Some of us were in clothes, we're dressed. But we have illnesses hidden in our bodies. That mental health is underlying it. And with care, in addition to your regular doctor's checkups, you're going to be comprehensively taken care of. Not patchwork, as I said, not patchwork. So when we bring a message of mental health, don't see it as a column standing by itself. In fact, there is a quote by a famous American Surgeon General, Dr. Satcher. There is no health without mental health. So whenever you think of health, think of it as a full complement. If you remove mental health, something is missing. So for now that we're here, you know, as Ghanaians, we sometimes, because there's not information to show us that a piece is missing, we may always think that if you belong in this set, that this part here would not the piece that is missing, and then of course you are deciding who belongs in that piece, not even knowing sometimes that you are there too. Your mother is there, maybe. Your sister, your brother, your grandfather's cousins, auntie, whatever the male generation, they are there. Do you stop loving them because they have mental health challenges?
I've been at the Foreign Ministry for about 35 years. And during that time, opportunities have come my way as a foreign service officer to do things both in Ghana and abroad. Maybe now that I've exited, because I turned 60 in December, this is an opportunity to give back some. And I find in what Adjoa is doing a very inviting and challenging activity, and I'll be more than happy to work with the founding principal to do what we can to improve mental health. Coincidentally, my third daughter is in medical school, and so I showed her some of the things, abstracts and so on about mental health. And some of her colleagues would like to go into that area. Part of the problem is that mental health as an area of specialization has been treated like the symptom itself. And there are very few people who are trained through the medical training facilities we have in Ghana to end up as specialists in that area. So I'm quite excited to be part of this endeavor, and whatever we can do to push it forward